Hello, and welcome to today's webinar, Vision to Action, the Power of Partnerships to End Hunger and Build Healthy Communities for All. I'm Rachel Forensic, a director for the Non-Infectious Disease Programs Department at the CDC Foundation. We're so glad you're here for the kickoff of the Hunger, Nutrition, and Health Action Collaborative. Before we dive into our program, here are a few housekeeping items to keep in mind. Today's webinar is scheduled for 75 minutes. We hope you'll be able to stay for the entire time. It will be recorded. We will share the recording with everyone who registered for the webinar. It will also be linked on our website, impacthunger.org. We know there are many experts in the room, and we hope to learn from you and create a space for you to learn from each other. Please use the chat to share comments and conversations with other participants. At the end of the webinar, we'll ask you to tell us what you learned and what you'd like to learn more about after today's webinar. You can share any of these aha moments in the chat in real time. Use the Q&A feature to send questions to the webinar staff and presenters. Due to the large number of participants, we may not be able to answer all of your questions live, but we will provide contact information for you to get in touch with us afterward if we don't get to your question. Let's get started with our first Zoom poll. Zoom poll number 1. That should be coming up on the screen. Great. What type of organization do you represent? Please take a moment to select one. Community neighborhood-based nonprofit, national nonprofit, corporation or for-profit business, foundation, philanthropy, academic, university, health system payer, trade association, professional association, local government, state government, federal government, or not applicable if you don't fit into any of these. We'll give folks just another second to put that in. Okay, I think we're ready to close the first poll. Let's look at the results to get a better sense of who is here today with us. It looks like we have the most representation from community neighborhood-based nonprofits and national nonprofits. Great to have you all here with us today. It is now my pleasure to turn things over to our president and CEO, Dr. Judy Monroe, for welcoming remarks. Judy, it's all yours.
Well, thank you, and welcome everyone. It's terrific to see everybody in the chat from all over the country. So keep letting us know who you are. So I'm Dr. Judy Monroe, as you heard. I'm President and CEO of the CDC Foundation. The CDC Foundation, if you're not familiar with us, we're an independent nonprofit. We were created back in 1995 by Congress to help bring together the public and private sectors and build partnerships that save and improve millions of lives in the United States and around the world. Our collaborations with the Centers for Disease Control and Prevention and private and philanthropic partners help create greater impact than any one entity can do alone. So throughout the years, we've raised and supported and launched more than 1,400 programs to take on complex health challenges and help CDC and partners, including the public health community, protect the health, safety, and security of people in America and around the globe. Today, we're here to launch the Hunger, Nutrition, and Health Action Collaborative, a strategic partnership network that will harness the power of collaboration to drive actions to end hunger and build healthy communities in the United States. While the effects of hunger can impact any American, the toll from hunger is not distributed equally. Hunger and food insecurity disproportionately impact underserved communities, communities of color, low-income families, and rural Americans. So since 2022, the CDC Foundation has engaged partners in a comprehensive approach that has secured more than $10 billion in public-private commitments in support of the White House's national strategy on hunger, nutrition, and health. The CDC Foundation's proud to lift up the work of others in this space and to act as a convener to bring together others that understand the fundamental role food plays in promoting health and preventing disease. I'm very pleased to extend a special thank you to the White House Domestic Policy Council team, and who we've had the honor to partner with and work with on the White House challenge to end hunger and build healthy communities. Last week, the White House announced 141 new bold commitments from stakeholders across the nation who are making significant commitments to address this strategy. Through the Hunger, Nutrition, and Health Action Collaborative, we will harness the power of partnerships to continue the momentum. I'm very grateful to the more than 200 community, state, and national leaders who are making big and bold commitments in this effort. Our commitment to end hunger and improve the health of our communities is multifaceted. Today is one example of our focus to bring people together to lift up examples of impact to address the challenges to end hunger and improve nutrition and health. We're actively working with many partners to bring together an action collaborative that draws together all the energy and wisdom and creativity that you all have. These individuals, organizations, and others engaged in the collaborative will identify, share, and leverage innovations, best practices, and standards to collectively work to end hunger. So thank you today for engaging with us. Together, we can make a meaningful and measurable impact to end hunger and build healthy communities. So Rachel, back to you.
Thanks, Judy. What a great way to kick us off today. Now let me take a few minutes to run through the agenda for our time together. The CDC Foundation has been honored to partner with the White House Domestic Policy Council since September 2022 to help secure over 200 commitments as a part of the White House challenge to end hunger and build healthy communities. But the work is only beginning, and today is just the start. In a few moments, we'll hear from staff at the White House who have led this work: Kellyanne Blazek, Gina Plata-Nino, and Will McEntee. Next, we will then hear about progress on the White House challenge commitments. We'll be joined by my colleague from the CDC Foundation, Darnisha Tabor. After that, we are excited for a robust conversation moderated by Dr. Monroe and leaders representing several organizations who made significant and innovative commitments to the White House challenge. Jofia Pastor, Linda Zambrano, and Latanya Horace Dubois, co-directors of the Fresh Food Coalition in Washington State. Nona Yahia, founder and CEO of Vertical Harvest Farms, and Dr. Shrila Sharma, professor at the University of Texas School of Public Health and co-founder of Brighter Bites. It is now my pleasure to introduce Gina Plata-Nino, Senior Policy Advisor on Nutrition and Agriculture for the Domestic Policy Council of the White House. Gina, thanks to you, Kellyanne, and Will for being here today. Please take it away.
Thank you, Rachel. And really, our gratitude comes to you and your organization. Thank you so much, Dr. Monroe. You and your team are incredible, and it's been such a pleasure to work with all of you. We are truly grateful for all of the work that you did in helping us accomplish the president's goal and putting us on the right path. As you mentioned, to everyone, at the historic White House Conference on Hunger, Nutrition, and Health, hosted by the president on September 28 of 2022, he announced the goal of ending hunger. And it's an ambitious goal, but it's a doable goal with what he set out in the national strategy. His goal is simple, and it's something that we can all do together, which is reduce diet-related diseases by 2030 and end hunger, all while closing disparities among the communities that are impacted the most, which is really important to make sure that we're addressing all of these inequities. At that conference, as Dr. Monroe mentioned, he announced a national strategy on how we were going to do this. It set out a playbook of how the president intends to meet this goal, and it sets out a call for a whole of government approach to address hunger. And we are doing this through specific policy actions in 5 main pillars. Pillar 1, improving food access and affordability. Pillar 2, integrating nutrition and health. Pillar 3, empowering all consumers to make and have access to healthier choices. Pillar 4, for physical activity for all. Pillar 5, enhanced nutrition and food security research. And since the conference, the administration has made and continues to make significant progress in implementing the national strategy. And like Dr. Monroe said just a few seconds ago, last week, we had the great privilege to announce the outcome of the March 2023 White House challenge to end hunger and build healthy communities. And I want to invite my colleagues, Kellyanne and Will, to jump in and just excitement about the work that is being done within the national strategy and the White House Challenge.
Thanks, Gina, and thank you for joining today, everyone. I also want to give a special thank you to Dr. Judy Monroe and Sharon, Colleen, and really the entire CDC Foundation team for being such incredible partners since we kicked this off in 2022. We really couldn't do this work without you, so thank you for being through us with us all. I just wanted to echo what Gina mentioned about the President's commitment to implementation of the national strategy. We're full steam ahead on taking action as the federal government and truly appreciate your continued partnership, especially through this new action collaborative. We've heard from many of you that you're eager to learn from one another, to build off each other's successes, and to make progress towards the President's goals. So we're excited to continue partnering with you and see how you're implementing your commitments as we go forward. With that, I will turn it over to Will.
Thank you, Kellyanne, and just want to again echo the thanks to the CDC Foundation, especially for being such great partners. Really excited to see the work that this Action Collaborative does in accomplishing what Gina laid out as the President's goal of ending hunger and reducing diet-related disease by 2030. And also just want to echo the thanks to everyone on this call, every organization who has made a commitment as a part of this work. Really the White House Challenge to End Hunger and Build Healthy Communities is really designed around the idea that we can't as the federal government tackle these issues alone, and we need a whole of society approach to this. And so the commitments that each of you have made will help us to get even closer to achieving that goal. And we're so appreciative of really every sector of civil society stepping up in the ways that you have. And we're excited about this Action Collaborative as an opportunity to build off of that work and to coordinate and collaborate across the organizations and communities that have made commitments as part of the White House Challenge and earlier through the commitments made ahead of the White House Conference on Hunger, Nutrition, and Health. As Kellyanne and Gina both mentioned, we continue to work hard on implementing the national strategy on hunger, nutrition, and health. So really excited. Thank you all for joining this call. Thank you all for your commitments and your commitment to this work. And we'll turn it back to CDC Foundation. Thank you so much.
Thank you so much, Will, Gina, and Kellyanne. I know we all really appreciate your leadership there at the White House. So again, thank you. It's now time for poll number 2, if we could have that. Gina mentioned the various pillars of the national strategy. And so now we'd like to know which, if any, of the 5 pillars from the national strategy on hunger, nutrition, and health describes your work. And you can select more than one. Improve food access and affordability, integrating nutrition and health, empower all consumers to make and have access to healthy choices, support physical activity for all, enhance nutrition and food security research. And if you couldn't find something there, you can always pick not applicable or none of these. We'll give folks about 5 more seconds. And we can have the results. Great, a lot happening in those top 2, but really a lot happening everywhere. Great, thank you so much for filling out that poll. And now it is my pleasure to introduce Darnisha Tabor, who is an evaluation specialist for the Non-Infectious Disease Program Department at the CDC Foundation, to discuss updates on the progress of commitments. Darnisha?
Thanks, Rachel, and hello, everyone. As shared by Dr. Monroe, give me one second. As shared by Dr. Monroe in the White House Domestic Policy Council To catalyze action for the millions of Americans living with food security and diet-related diseases, the Biden-Harris administration launched a transformational call to action for ending hunger and reducing diet-related diseases by 2030, while lessening disparities among communities impacted the most. The call to action has brought in organizations across the public and private sectors. Since the inception of the call to action, the CDC Foundation has served as a partner in gathering new commitments and also tracking the progress of ongoing commitments. Next slide. The work being done through these commitments represents a cohort of change agents who are working to strengthen health systems, generate new research, and mobilize partnerships to increase access to social services, healthy food, nutrition education, and physical activity in communities living with food insecurity and, as a result, most at risk for chronic illnesses. The work being done through these commitments, again, will continue up to 2030. Next slide. As I shared previously, the CDC Foundation has played a role in tracking the commitments, and across phases 1 through 3, there have been over 200 commitments across the public and private sector. 51% of the commitments have a nationwide focus, 33% are regional, and 16% are at the local municipality level. Next slide. From our tracking, we also learned that the commitments represent a diverse group of actors. 35% of commitments have been made by nonprofits, followed by 26% made from the private sector and 13% from government agencies, primarily local agencies. The remaining commitments came from universities, other organizations, and health systems. In July 2023, in collaboration with the White House Domestic Policy Council, the CDC Foundation launched the Partner Commitment Survey 2 to capture progress of 68 organizations who had approved commitments at that time from February 2023 to July 2023. The survey sought to capture their progress, feedback from organizations on the type of support, if any, they would need to keep their commitments moving forward, and just to catch any other insights from their work. 50 out of the 68 organizations responded to the survey, which was great, and the majority of the responses came from corporations and national nonprofits, foundations, trade associations, community-based organizations, health systems, and academic institutions, as well as government agencies were also represented in the survey responses. Next. Organizations were asked how much progress they've made toward their commitment, and the overwhelming majority, 92%, shared that their commitments are on track to be completed by their set deadlines or have already been completed. Next, I'll be sharing a few examples of how the commitments are already making a huge impact. The Partnership for Healthier America and the Boys and Girls Club of Central Mississippi is committed to expanding on the Good Stuff kiosk program, which was launched as a pilot in Jackson, Mississippi and Planeta, California. Funded by the Sodexo Stop Hunger Foundation and Dole Packaged Foods, the Good Stuff kiosk has an assortment of key staple items, both shelf-stable and refrigerated, and priced for families in under-resourced communities, and these kiosks are located at community hubs where they're already going to pick their children up at after-school activities. And the kiosk is also combined with nutrition skill education through cooking classes. These kids' cooking classes teaches baking and cooking healthy recipes to increase the intake of fruits and veggies. And the recipes also make it easy for the kids to bring these recipes home with their families so that they can make them together with their parents or guardians. This type of partnership is really exciting to see in the lives of children. Next slide. Next, in September of 2023, the Eat, Learn, Play Foundation announced their ambitious plans to partner with the Oakland Unified School District and Kaboom to transfer 25 schoolyards throughout Oakland by the end of 2026 as part of an effort to give Oakland kids access to safe and quality places to play in their neighborhoods. Excuse me. Kaboom and the Eat, Learn, Play Foundation share the same goal of expanding access to safe and kid-friendly options for physical activity, which is really transformative for communities. Next slide. And lastly, I'll be highlighting the Nubian Markets, which is based out of Boston. Boston Medical Center provided a $1 million loan to Nubian Markets, a curated market, cafe, and gathering place celebrating the African diaspora through food. Led by a team of Black Muslim entrepreneurs, the co-owners drew on their African American and East African roots, as well as their Muslim faith, to create food options that would resonate with the people in their diverse neighborhood. The funding is part of the Boston Medical Center's overall commitment to addressing social determinants of health, which are non-medical factors in people's lives that affect their health outcomes deeply. Partnerships such as these are great examples of innovative food solutions that are making a huge impact in the communities that they're serving. The CDC Foundation looks forward to continue to being a partner in this work. And thank you for the opportunity to highlight some of this amazing work today. Over to you, Rachel.
Thanks. And Darnisha, before you go anywhere, we want to just make sure, see if anybody has any questions for you. I know someone did ask in the questions if this data is being available. And my understanding, if we're going to make this available, and my understanding is we do have this executive report available on our website, impacthunger.org. And we can also put these slides there. Is that correct?
Yes, that's correct. We're excited to share this amazing work and happy to answer any other questions as well.
I know the CDC Foundation will also be looking at tracking commitments going forward. And while there was a question about what the timing of that would be, we're not exactly sure. So we do hope that folks will put give us, send their emails to us so we can keep them updated through periodic communication. Someone is asking what CDC stands for. Shall I jump in and mention the CDC is the Centers for Disease Control and Prevention, and we are the CDC Foundation, which is a nonprofit that helps develop public-private partnerships in support of much of the work that the CDC does. And apologies that we didn't say that earlier.
Yes, thanks, Rachel.
Sure.
And I see there's some other questions in the chat around recipes for the cooking classes for the kiosks. I'm not certain on that, but I can get that information for folks, and maybe we can send that in the follow-up.
Great. We do have a place on our website where we have resources and stories from the field. And that will also be a great place for us to put things like this, links to what folks are doing out in the community.
Definitely.
Darnisha, Carla's asking if you're favoring locally grown produce for the kiosks.
Personally, I can't speak specifically to what the Good Stuff kiosk is, but I know there is a specific feature of that work on the website that shares about where they're sourcing that food.
Fantastic. Thank you.
Thanks, Carla.
All right. Darnisha, thank you so much for that presentation. And again, we will make sure we have the URL in the chat for folks to access the executive report of this. So thank you so much.
Thanks, Rachel.
Now we're going to turn to our next two polls. So if those can come up, poll number 3. What would be most helpful to accelerate your work? You can select more than one of these. Funding to work across sectors, access to specialized resources, capacity building and technical assistance, expanded network of partners and stakeholders, transformative policy changes, building public-private partnerships. Great, you can take that poll down. Here are some results. Funding to work across sectors. Transformative policy changes is also high up there. Great, these are all important. Thank you so much. Now we can move to, I think we have one more poll, poll number 4. Who would you like to partner with, but are currently not? And you can select more than one of these. Community, neighborhood, nonprofit, national nonprofit, corporations, foundations or philanthropy, academia, health systems, trade associations or professional associations, local, state, or federal government agencies, or none of the above. Okay, I think we can go ahead and close this poll. Great. As we know, for this to be, for us to have this be a whole of society, we really need all of these different sectors engaged in this work. Keep the chats active and send in your questions. We're just getting warmed up. It's now my pleasure to turn things over to Dr. Monroe and her awesome panel. Judy?
Thank you. And it is an awesome panel. I can't tell you how excited I am about this. So we're really thrilled to have the unique experiences and the perspectives of partners who've stepped up to the challenge to end hunger and improve the health of our communities. Through major investments and partnerships, you're already making an impact. So I want to welcome to the panel Nona Yahia, CEO of Vertical Harvest Farms, Dr. Shrila Sharma with Brighter Bites, Jofia Pastor, Linda Zambrano, and Latanya Horace DuBois with Fresh Food Coalition for being here. Thank you in advance for sharing best practices and priorities that'll help activate more progress to helping the millions of people living with food insecurity and diet-related diseases. So let's kick off with our first question. Tell us about the commitment, because you all have all made commitments. So tell us about the commitment you've made to the White House Challenge to end hunger and build healthy communities. And let's start with Jofia and Linda or Latanya. So you guys go in whatever order. Take it away.
Well, hello, everybody. Thank you. And it's an honor to be here. We are the Fresh Food Coalition, an organization that is actually led by three nonprofits: the National Tribal Emergency Management Council, Farmer Frog, and the Silent Task Force. We have formed this partnership through the pandemic, as we were servicing over 3 million people in 38 states across this country with food and emergency supplies and water, and distributed these important supplies and food in a very urgent way in various transportation pathways. We concluded that our efforts actually required a more formal coalition. And in the past few years, we have came to the understanding very intimately what the community's needs are. And our commitment focuses on the Pacific Northwest, the Pacific Coast neighboring states: Alaska, Northern California, Idaho, Montana, Oregon, and Washington. We are addressing all 5 of the pillars. So our commitment is centered around a holistic approach that addresses all the issues that were put forth by the White House. And it is focusing on the most crucial missing elements of food sovereignty, culturally relevant foods, and it is post-harvest and processing that we center our commitment on, because what we have found is that the communities, the BIPOC communities, the tribal communities, the immigrant and refugee communities we service really have no food sovereignty and access to relevant and independent processing.
That's great. Thank you. Thank you. Anything from the others at this point? Anything more to add? Uh-oh, it might be muted.
There we go. Yes, thank you. Thank you so much. I'd like to just reiterate what Sophia said. in regards to it being an honor to be here. We thank you for the original invitation, and we're really proud to be able to be here and share the work that we do today. The most important thing that I think that Sophia highlighted is that when we first all came together, each of us as nonprofits had our sector that we were serving. But one of the things that we discovered was that by bringing the three of us together, we became that force multiplier that was able to do so much more work. We literally took one organization that was distributing 35 million pounds of food to the three organizations, then distributing more than 230 million pounds of food in a very short period of time. And so what we saw was an opportunity to partner with other like-minded organizations through this coalition here, that perhaps we could find partners in which we could again become force multipliers and be able to really exponentially grow the work that we're currently doing. When we see those numbers that are escalating in regards to food insecurity, we all have that common goal to reduce food insecurity. Coming from the BIPOC communities, us three ladies have a commitment to also do that, though, in a culturally appropriate and culturally sensitive way. One of the things that I always like to share as a specific example that just kind of drives the point home is that just in the last couple of years, we had Typhoon Merbok hit our Alaska villages, and we had 67 villages that literally flooded, lost power, lost their food stores, and in the middle of winter. And so if you can imagine waking up one day with no food and no way to be able to access food because you're in the middle of this typhoon, it was very difficult for them. And down in the lower 48, it was easy for people down here to immediately jump forward and say, we can send you boxes of macaroni and cheese, and we can send you jars of spaghetti sauce, and we can make sure that you get foods. But when you're talking to our Alaskan villagers, they need things that are culturally appropriate, like salmon and seal oil. And those are things that are a lot more difficult to get during those times. And so our commitment has been to look at each of our communities from that cultural lens and making sure that we're bringing forward culturally appropriate foods to our communities. And so with that, I will pass the baton over to LaTanya. And again, thank you everyone for inviting us and for having us to be here as guests today.
Thank you, Linda. I'm LaTanya Horse-Dubois, founder and executive director of the Silent Task Force, and I'm honored to be here today, especially with my teammates, my colleagues. As you know, Linda, it's a lot to follow what you just gave. It was just amazing, and you just hit every nail on the head about the work that we collectively do, and we do culturally specific for communities that we all serve. We live in a very diverse part of the country, and we serve a lot of people that all deserve to be fed and all deserve to be, you know, healthy and well. And we have seen through COVID, but prior to COVID, food insecurity existed. It wasn't like, oh, it just happened when COVID happened. It just exacerbated an already historic issue in BIPOC communities. And so it put a spotlight on what already was, and it encouraged the partnership, because what is realized is that one organization alone cannot do it. It requires folks with a like mind, with a heart to serve, who've already been serving. Of course, a lot of folks started serving during that time, and that's a great thing because they want to serve to a greater cause. Mm-hmm. They want to help folks who are in need, and we all know that so many people were. And so it's just an honor to work alongside these incredible ladies and the teams that they lead to do the work in the community. I represent a community that is disenfranchised as well. It is the African American community. We're the last Blackest part of Seattle, Washington to date. We have been displaced and gentrified completely out of our cultural homes, ancestral areas where we have lived for generations. And so with that displacement comes hunger, comes homelessness, and a host of other needs that we're all facing. It's not just in this community. And so that's what's so important about our partnerships, is that we can see across the board for all of our communities, the things that are happening that are impacting all of our communities in the same way. And we may be speaking of different cultures, but it's the same social, societal issues. And so it's just food sovereignty is what we need. It's where we want to be. It's kind of like a participatory design situation where, you know, the community gets to say what they need and what they want, and having the government say, yeah, the community does deserve that. And we can let the community decide where these public dollars and funds go to, right? And making those decisions and ensuring that community has a hand in lifting itself up in a positive way, because there's a lot of struggle. And there's a lot of resilience in the struggle, and everything costs. Nothing is free, right? And so we've seen many of our farmers lose their farms, and BIPOC farmers, right? People who've been doing this work for some time, and that's been hard. It's been actually a bit of trauma associated with that, because it's like, it's the same old thing. It's just a different day, and it's just a different time in history, but this is not a new thing once again. So we're just honored to be here. And I'm so honored to stand beside these two amazing, amazing leaders. I learned so much from them, and it's just an honor to be here, and I thank everybody. So
Thank you. Well, thank you. Talk about force multiplier, and you all have really given us an example of what that means. So I'd like to turn now, Nona, tell us about your commitment, and then we'll go to Srila.
Well, thank you so much, Dr. Monroe. I am so pleased to be here and honored to be here with all this panel of amazing women. March is for women, so this is, I think, really appropriate. Right. And the Fresh Food Coalition, I can't wait to work with you. So I'm Nona Yahya. I'm a CEO and co-founder of Vertical Harvest Farms. So we're a controlled environment farm, so an indoor farm, and we're hyper local. So what does that mean? We feed locals first. So you can see why I'm excited to get to know the ladies before me. Instead of building farms on the outskirts of cities, which is where we've seen the indoor farming industry really go, with no real connection to the consumer, we build right in the heart of the urban center to reestablish that vital connection between farmer, food, and those we feed. Like all of us here, I know that we share this deep held belief that good food is a fundamental human right. So with our farms at scale, which we're right now expanding across the country, we started in Wyoming, we're building one in Maine, all places with a very short growing season, get their food imported from outside, mostly from California and Arizona and Mexico. We're replacing 2.5 million pounds of produce in order to facilitate our commitment to support institutional effort to respond to the demand for local food across all consumer channels. So this isn't only about retail, it's about our anchor institutions, our schools who feed our children, K through 12, the higher education, hospitals who desperately need a consistent source of local food at volume. So we're participating with trials in our farms, in tastings, in nutritional trials, getting kids hooked on good food. In our farm here in Wyoming, we do tours, and our favorite thing is when a child will bring their parent to the farm and say, this is my favorite type of microgreens. Microgreens can have up to 40 times the nutritional equivalent of their adult counterpart. So imagine the sea change of nutrition if we can pull off that kids are really actively trying to find where can they purchase microgreens. We're farm to fork in 24 hours. Most of us eat lettuce that travels 2,000 miles to get to the plate that we have. It's not worth its nutritional or taste value. So this enables us to deliver food at the peak of its flavor and nutrition year round. So we're not just feeding people, but feeding them well. So we've also committed, in addition to our customers, to sending a percentage of our produce directly to the charitable food system. So the work that a lot of you do, I saw all of you coming on to the panel. It's really exciting to be able to liaison with all of you and answer your questions. These organizations recognize that no one should wonder where their next meal is coming from. But we're also saying that these meals should be the best that they can be. We've partnered with the Food Bank of Wyoming, and the Food Bank of Wyoming never had access to produce, to fresh produce, to be able to deliver to Wyoming. Wyoming is a food desert, and we've been able to bolster the local food economy at scale through our commitment, and we're just so grateful to have the opportunity to do so.
Thank you. Thank you. Srila, over to you.
Yeah, gosh, what an exciting group. This is fantastic. Thank you so much for the opportunity to be here. I also want to take a moment to give a shout out to my colleagues at the University of Texas School of Public Health and Brighter Bites and Planet Harvest and others who are part of our commitments to the White House. So, you know, I sit here in front of you guys, but this is really a team effort, right? None of us do this alone. And I love the term force multiplier, because that's really where the magic happens. So, you know, we actually made 3 commitments to the White House in this space. Our Center for Health Equity at the University of Texas School of Public Health is really focused on how can we create sustainable solutions to address this very sticky issue of food equity, right? And so our first commitment is to build a really strong infrastructure of technology capacity of care coordination between healthcare and social services, so that our patients can actually receive the services they need that they're referred to. So a patient that's referred to receive a food prescription program, well, how do we know that they're actually going to get it? And so we're building out that core infrastructure. We're leveraging our health information exchange that has a master patient index of 16 million patients. And we're starting there to then scale this technology infrastructure throughout our region. Our second commitment falls in the space of food as medicine. And it's in partnership with Planet Harvest to really implement, evaluate, and scale a robust produce prescription approach for pregnant moms. And, you know, I live in Houston, Texas, and Texas, as we all know, unfortunately has some of the highest maternal mortality rates for our Black women, and it's just unacceptable. And we just need to do better. And so really addressing those, you know, root causes associated with poor outcomes during pregnancy is what we're trying to get at. And then last but not least, I'm also co-founder of Brighter Bites, which is it's a national nonprofit that combines access to fresh produce with nutrition education through schools and also our health system partners. And so what we're committing to do is partner with school-based health centers. And we're starting with Legacy Community Health, which is a federally qualified health center that has school-based health clinics all around our greater Houston region. So we're starting there. And we want to implement a home delivery-based produce prescription approach combined with, again, a robust nutrition education model, teaching our kids how to, and our families, you know, how to use the produce that they're getting, converting those food into culturally relevant, tasty meals so that kids everywhere, and these are Medicaid eligible kids, can eat healthy and tasty meals. So those are our 3 commitments to the White House that we're very excited to share.
That's awesome. Well, all of you are remarkable, let me just say. So Nona, I want to come back to you for a minute. I heard a lot of things in your description of your remarkable work, the things that are different and unique, but do you want to expand on other things maybe that might come to mind that are unique about what you're doing and why it's important?
Yeah, you know, Dr. Monroe, I'm an architect by trade. And so I've always believed
that's unique right there.
Yeah, architect turned farmer. So I've always believed that design can be a powerful instrument for change, right? And so how do we look at the fabric and the infrastructure of our cities to address, some of the inequities that we've all discussed here, right? And how can we improve that? And how can we especially address people on the margins? We must, and this is what the White House Challenge is all about. We must really look at what our 21st century problems are. So we really see this indoor farm as a new type of civic infrastructure that utilizes food to solve multiple problems simultaneously. So yes, we're investing in certain climate adaptation strategies that will help our food system be more resilient, because we're already seeing the stress impacting yields. The way we grow food right now is neither stable nor resilient, as we've prioritized quantity over quality, but we've not seen anywhere near what's going to come, right? So we need innovation, we need strategies. But climate change isn't just an environmental issue. It's a social justice issue, it's a public health issue, and it's an economic resiliency issue. So we're a private sector business that lies at the intersection of these issues with the intent of developing a more inclusive form of capitalism. So as we combat food insecurity, what other problems can we solve? In our cities, where our farms are placed, we have more jobs than the traditional labor market can fill. There's another labor pool that feels entirely left out of the opportunity. Across the country, people with disabilities suffer an average of 80% unemployment rate. They're the largest minority in the US, and one that we could all become a part of at any time. So can we, the question we ask, is open up the fastest growing industry in agriculture, controlled environment, farming, to this untapped workforce by focusing on ability, by focusing on human potential. So these community needs are actually why we became vertical farmers. The technology is cool, but that's our why. We grow better food and futures, where food, not design, is our medium for positive change. By reconnecting the farm to the city, we're reconnecting people to who their farmer can be. 40% of our employees suffer some sort of physical or intellectual disability. So with our work, we've seen how our farm is a new type of infrastructure that embodies conscious and radical inclusion and really adapts to the community needs. Who are our underserved workers? We're eliciting voices of all to cultivate and form a new and burgeoning industry. But more than that, we see our farm as critical to each community building its own strength. So with this approach, we differentiate ourselves within our industry, but really with the work that we do by building a brand that means something to you, your family, your neighborhood, and your city. And we feel that it will be valued like a public library or a community center in the future. And that's where farms and the potential of food can lie.
That's amazing. I mean, that's just amazing. Any reaction? Linda, I see your body language. Any reaction from LaTanya, Sophia?
Oh,
Linda?
I concur 100%. I mean, I think that that's where the future lies, and I think it's absolutely wonderful that your background is in architecture, because how applicable is that to what we're trying to do? I mean, we're trying to build something, and I always tell people we've got to have that strong foundation, or it all comes tumbling down. And we've got to have a methodical way of approaching all this. My background's in biology and chemistry, so I've got all that science background that's always going through my head. And then again, when we talk about, bringing together all of these different disciplines and all of these different levels of expertise in these different areas, I think is what really gives us our greatest strength. And so we're not only bringing forth the diversity of food, but we're also bringing forth the diversity of our skill sets and our levels of education and our expertise to bring this project to fruition. So that would be my 2 cents to add. So
Yeah,
thank you for your presentation.
I'd like to add that we have been working with Murray Hallam and Will Allen in international and national projects and settings, and have been working with vertical farming, especially combined with aquaponics and growing food and produce and protein in the same system. So this is really interesting. And my background being in landscape architecture, horticulture, and urban agriculture, this is very exciting. And I'm really looking forward to a lot of the collaboration that's possible.
Fantastic. Fantastic. So Shrila, I'm going to turn to you. Let's come back to you now. And what do you think's missing from the national discussion on hunger, health, and nutrition right now?
Yeah, I mean, it's such a great question. I will tell you that I first want to acknowledge how energized I was to be at the White House event last week and see familiar faces and partners around the country coming together. I started working in this space of food security when we didn't even have a definition for it or knew how do you measure it? So we've come a long way, and having 141 commitments exceeding $1.7 billion. I mean, that is something. So, I think it's important to acknowledge this momentum and the movement, to do this work together. So, but having said that, in answer to your question, I think what we are hearing also from our colleagues here on this call is that it takes us all, right, to address this issue about hunger, health, and nutrition. And there's never going to be a one shoe fits all approach. And so I'd like to see more approaches where healthcare, social service agencies, for-profit companies who are developing these solutions come together in that development. I also want to see, agriculture growers at the table and part of our strategic plans. While we are talking here about how do we grow food, there's also a flip. The problem that we have is billions of pounds of produce that's just left to die on the field that's nutritionally adequate, right? And so I think there's also a role for funders, especially because a lot of the competition in this space is fostered because of funding, right? And so funders can foster innovation through collaboration and have discussions on how can we create value proposition and business models across the spectrum so that we can sustain and implement these efforts, because all of them are going to be needed, right? Whether we are tackling, like with Brighter Bites, we are tackling food waste. We want to bring in produce that would otherwise be thrown away and channel it directly into the hands of communities that need it the most. We need that solution too. And we need we need to grow better, smarter food to feed the masses. So I'd like to see that discussion. I'd also like to see how we can bring our community voice and equity into the conversation so that it's central. Again, our patients and our communities that we serve really need to be at the center of these conversations that we're having. I want to share a quick story about the work we're doing with Brighter Bites. Brighter Bites, again, as I mentioned, we're trying to channel produce as much as we can that would otherwise be thrown away and bring it directly into the hands of families that need it the most. We have a very evidence-based formula that consists of produce distribution, nutrition education, using culinary nutrition approach. But we do it all through partnerships. Brighter Bites does not own, so we serve about 60,000 plus families every week around 12 US regions at this point. We are partnering, as I mentioned, with clinics and schools, but we've done it without a single warehouse or a single truck. And that's only been possible through partnerships. We've partnered with growers. We partnered with Cisco Foods, for example, who will carry those pallets of produce from the grower partners to the Houston Food Bank, who will then do the inventory and distribution of the produce to the schools where our staff will take it and send it home and go the last mile and work with the families, teaching them how to use it. And then we monitor all of this in real time and measure impact. I think and that's where, and we found that a lot of the value proposition is for the partners as well, is that not only is it mission aligned, but that they want to know if their investment is having an impact. And so that measuring of the impact has also been important as well in creating these partnerships, not to mention there's a tax write-off for the for-profit partners as well. So I'll just stop there but these are some of the thoughts and what I would like us to discuss more.
Very good. Nona, quickly, anything you would add that is missing from the national conversation?
Well, I think, Srila, you mentioned, right now, if each individual is working on these problems, we move in inches. Together, we can move in miles, right? And so these partnerships are so important, and they have to be long-term vision-based, right? We are working on the now and the future at the same time. And I think we have to be very intentional about the adoption of innovation and to new technologies that we support, and really understand the why behind their adoption. So for us, innovations in agriculture can help us destroy and dismantle perceptions and biases against people with disabilities. This is very personal motivation for me. I have a brother with disabilities, and when my parents immigrated to this country, I, from a very early age, understood that what they could give me and what they could give him were very different. So I was an advocate before I even understood what the word meant. And people with disabilities represent 50% of those living in long-term poverty in the United States. And there are, limits into how much money they can actually make. It's an enforcement of poverty, right? So how do we utilize technology to improve lives, right? So in this case, vertical farming, but also save money for our governmental institutions, for our hospitals, right? For our healthcare, and really help our communities at the same time. So for a very specific example, our farmers at Vertical Harvest, before they started working for us, they were really relegated to what we call food, filth, and flowers. These are entry-level positions, right? Now, we all have to start somewhere, but the difference is that there was no path to career development. So utilizing technology, utilizing customization and adaptability, and really focusing on ability, we've now created people who are really leading the field by not only contributing the most valuable commodity to any community, healthy, nutritious food, but as we expand to Maine and Detroit across the country, which are the next two farms, they will be our leaders and our teachers of tomorrow. They will be leading this industry and representing careers. There are populations across the United States that deserve this this wealth gap, this opportunity to close the wealth gap. And so we can do this if we have that long-term vision and are really intentional about how we use innovation and why we use it in our communities and with our governmental support and our public-private partnerships. So that's what I would add. I had a lot more. I'll stay there.
Thank you. Oh, thank you. Yeah, so actually we're coming up on the end of our time. This is just like flying by. I'll ask for short answers now because I want to get to all of y'all on a couple of last questions here. So this question for all of you: while diet-related diseases are affecting Americans and access to nutritious foods, they're a challenge across our country. We know that. But what gives you hope that everyone can be healthy? All right. So I'm gonna start with Fresh Food Coalition. Anyone?
Yes, I think that the greatest hope is displayed right here in this meeting. We have an absolute awareness amongst a lot of the leaders in this country and professionals who are tied into the food system, who actually are representing their communities, who have lived experience, BIPOC, Native communities, immigrants, refugees, LGBTQ, the people who have been minoritized by the institution and the system for way too long. And this understanding, as Latanya had mentioned, was really brought forth with the pandemic. But we also understand that this is not a result of the pandemic, and that solutions must be holistic and addressing the root causes. So seeing that and seeing the excitement of coming together and working together, even like with our coalition, we are 3 organizations leading this, but we have hundreds of organizations who are participating at various levels and in this work. And that's how we are able to work together and provide services nationwide and have also international partnerships. This is a very strong hope for the future. We also understand that the U.S. economy and the food system is also organically part of the global economy and global food system. Food sovereignty is a human right, and that includes everyone on planet Earth. And I think that youth in particular are connecting in to this conversation now in larger numbers, and our elders are able to actually share their wisdom. And these conversations and interactions are important, and focusing on the cultural relevance and traditions is a very important pathway to foster success. So that's what I see every day, and it's really exciting. And again, just this conversation right here in the last half hour was very powerful. Thank you.
Yeah, very much so. Srila, what gives you hope?
Well,
Quickly.
I think conversations like this give me hope. And I really want to thank the CDC Foundation for creating this space for learning and sharing and collaboration. I think, those of us who've been working in this space for a long time, when we didn't even, we felt siloed and alone. And so it's exciting to see how much is happening, and we need to learn from each other. And I also, my community and partners, I'll be honest, give me hope as well. One thing I've seen, which is amazing, everybody, there's a realization that this is not an issue that any one organization can solve. So by the nature of it, people are coming together to collaborate, and part of collaboration is sharing power. And to see that happening is really exciting, and that's, I think, what gives me hope.
Awesome. Nona.
Well, I concur with everything that was said, but I think that, nourishment is such a powerful tool for building connection, right? The fact that we're all recognizing that we're on a tipping point for food, right? The way that we truly connect, as Shrili just said, is by helping each other thrive. And food erodes our differences, right? It gives us something to create and share together. It literally fuels us. What we found is that nobody can argue with food and jobs, no matter where you are on the political spectrum, right? And so that fuels us. And, I think that this approach has helped us align with national and civic leaders, with municipal strategies, with investment and development partners, and suppliers to build a loyal customer base. And that's all going to help us have a positive impact, right? But it's really the boots on the ground that motivate me. This is not for the faint of heart. And I think, Sophia, you just said the young people, right? Showing up every day, right? We're a female-founded company. And Srila, you said we've been siloed up until this point. Thank you to everybody for bringing us together. But, people really show up for this effort, right? To show that what you can do through a vehicle. And I think that, when you see the impact the work has had on individuals that we work with, from empowering first bank accounts, signing apartments, reversing guardianships, and resumes filled with experiences in green tech, you can see that that you are connected to doing something locally that has a global impact. And so that is what keeps me getting up every day in this very difficult time and challenging place, but we see what it means.
Very good. Very good. Okay. My last question. This is so what is something or someone that if we all listened to or read would transform our work or just make us all better humans? So what are the best resources that you might recommend? And so, Linda, I'm going to turn to you first. Podcasts, social media, books, people, what would transform our thinking?
Oh, goodness. Well, I think you better choose somebody else to start with. I need to think about that for a minute.
Okay, think about it, Srila.
Yeah.
I actually like to, in my day job as a professor, I have to do a lot of reading of, these very exciting peer-reviewed publications. But what really I like to be in learning spaces, and the space I feel like I've learned a lot on. My biggest growth has been actually learning from the space of how business works, for-profit companies, and bringing those learnings into the work that we're doing in the non-profit space. So I listen to a lot of TED business podcasts, for example. I also have learned a lot from Adam Grant, who is an organizational psychologist. And I forget, is it Work Life? But it just really, the work that we do can have a weathering effect, right? And so I think having the motivation to not just for yourself, but for your team, your community, to keep moving forward and doing it in a way that's healthy is important as well. So I've learned a lot from Adam Grant. As well.
He's very good.
Yes.
Latanya, do you have one?
Yes, I absolutely do. And I'm happy to share this. It's called the Virtues Project International. Virtues are the essence of who we are, and they describe the world's sacred traditions as the qualities of the divine and the attributes of the human spirits. I've been using the virtues since 2009 in every aspect of my life. Virtues are The project is to instill the practice of virtues in everyday life by helping people of all cultures to discover the transformative power of these universal gifts of character. So they're the spiritual life skills to help us live our best lives, be the best person we can be to ourselves and to one another. I can honestly say it transformed my life. Wow. It's transformed the youth that I've worked with, and they were kids that were incarcerated or at risk. Also elders, people who are just struggling in life. And it's very basic, but it's very true and spiritual, because it's not a religion. It's just the virtues, right? The gifts of character. And so if more people understood that, or they already know it, but you can call it what it is, and live by that, then the more people are healthy, healed, and are willing to help one another. So that's my offering.
Thank you. Thank you. Rachel, do we have time for a couple more answers?
Yeah, please.
Okay.
Yeah, I'm ready with my answer. I would go back.
Oh, perfect.
Yeah, because I was coming from it from a very different perspective. And from my perspective, the people that because I work with tribal communities, I would say it's our tribal elders that are the people that we revere in Indian country. But we don't spend enough time sitting with them and listening to the stories, because we live in a society where we're all about instant gratification, and we live at such a fast speed these days. And the tribal elders really operate at a much slower speed, and they tell the story. And if we take the time to listen to the stories, we learn so much from them. And so that's kind of where I would be coming from on this particular question. Is taking the time to listen, and not just to the tribal elders, but elders in many of the different cultures. I remember when I first started, FEMA came out with their strategy 4 years ago. And when they came out with the strategy, they called it the culture of preparedness. And I remember immediately writing back to them and saying, you need to add an S after that word culture, because we live in a country where there are so many different cultures. And if we try to approach what FEMA's doing on one culture of preparedness, we will never succeed. But if we listen to all of the different cultures that make up the fabric of this country, then I think we can have such greater success. And so that would be the way that I would approach that question. Thank you for giving me a moment to circle back on that.
Absolutely. Well, we need to take time, right? I mean, we just said we need to slow down sometimes a little bit. Rachel, I'm going to turn to you once again. Do we have questions coming from the audience, or do we want to keep going with
We have so many questions, but I did one question I do want to pose, and if maybe one of you would want to answer it. And those who, since we don't have a lot of time, if the others want to write some notes in the chat, that might help. But it's an important one. And it's from Diane, and it is, how are you engaging community members with lived experience to inform your programming? I know all of you are, but would one or two of you say a brief word about that?
I would like to speak to that if I could. I know we engage our community boots on the ground. We have to. Our community is quite stigmatized, and that the resources, we've been underfunded for a very long time, and the resources don't actually exist in the community. So in order to get in touch with the community and know what's going on, you have to do outreach and engagement. We've done the outreach engagement. We have a youth workforce development team, and the young people, of course, with some of the other staff members, go directly door to door in different communities where we know there are elders who cannot come to get a food box, that cannot cook for themselves, right? So we go to those doors and we knock on the door and we ask people. We do outreach, engagement, surveys. We've even done videos because so many elders lost so many friends. And so to capture cultural history before they're all gone, we for so many of them are gone and we can't, get that back. We've been interviewing our elders and asking them about various things around recipes, how many people that, that they've been working with and helping to feed that have passed due to COVID, and just, honoring them, but also working with a lot of large families. We have a lot of refugees and immigrants in our state, and we have to feed everybody. We can't just say, yeah, we're culturally specific, I only feed my own. No, we feed everybody. And so ensuring that we understand what those needs are, and we have to be on the ground. Nobody's just going to give you that information. So it's important to be amongst the community, for the community to know that you're reliable, you're consistent, that you care, you have compassion for this need, and to provide more than food. Food is definitely a linchpin, but as someone was saying earlier, there's a lot of social services that are needed. And our community is on fire when it comes to homelessness, when it comes to mental health, when it comes to drug abuse, when it comes to families being homeless and young people needing. We have a unaccompanied minor issue that is ridiculous here that no one wants to talk about, but these are kids from kindergarten to 12th grade who are homeless and don't have anybody to accompany them. So there's various issues that impact the hunger issue, and there are various issues that require community to be present and boots on the ground and providing these services, because there are too many gaps in services. Once the money's gone, the issue still exists. And so it's incumbent upon community to pull ourselves together to continue trying to provide the services that our community greatly needs. So boots on the ground is everything. Communicating directly with community is everything, because how else do you know what the needs of the people are? I can't tell you based on just what I think. I have to ask them. And that is a constant, ever-growing volunteer opportunity. Hopefully we can hire you and get the funding to hire you. Constant conversation, growing thing that happens as we build relationships in community, because it's about relationships, right?
And I'm going to add to what LaTanya just said very quickly and keep it kind of on the shorter side. But each and every single one of us as individuals are also teachers, and we can take every opportunity every single day to train the community and educate them in regards to the things that we're working on. We operate several different community training opportunities, from free curriculum from FEMA, which is the Community Emergency Response Team training. We have this really cute program that we call the Bears and Cubs Club, where we bring in grandparents and youth, and we teach them about diabetic-friendly foods and diabetes, and we provide them with not only the food but the recipes to go with the food to teach diabetic-friendly meals for our families. We tie it into our Block Watch program, in every different avenue that we can. We try to find a way to educate the community. But again, we're all individuals. We're one person. And so we put a really heavy emphasis on train the trainer. Yes, we are trainers, but we all have a responsibility to train others to be trainers, so that again, we've got that force multiplier, that we're able to get out there and exponentially grow what we're attempting to do each and every single day. And the more that we can work together as teams, understanding that it's not about silos, understanding that it's not about kingdoms or fiefdoms or, any one individual person, but it really is about the collective. And the more that we can really showcase that, people get excited and want to be a part of that. They want to be a part of the winning team. And so if we can continue to really promote that winning team, we're going to win. And so, yeah, so that's where, we definitely want to make sure that we're keeping that in mind each and every single day, that as individuals, we do have that responsibility to reach out and be the teacher every day.
I have to tell you, I don't know when I've been with such energetic, passionate, smart, loving people as I have, as all of the women. As you said, March is International Women's Month, right? It's so what a great month to have this all woman panel, if you will. And thanks so much. This has really been inspiring. Rachel, over to you. I think we're in overtime.
We are in overtime, but thank you so much. This was really difficult to stop. We really are coming into that tension of needing to take time to listen and talk, but also wanting to respect everyone's time. So thank you for those of you who are able to stay on a few more minutes. Thank you again for such a lively conversation. My colleagues are going to put a couple questions into the chat. If anyone wants to type them in, wonderful. Or you could also tell us this when you fill out our evaluation that will come, which we hope you will. And one is, we'd love to know something you learned today. And even more important, we'd love to know something you'd like to learn more about after today's webinar. So thank you so much. Again, thank you so much to our guests today, Kellyanne, Gina, and Will from the White House, Darnisha from CDC Foundation, Nona, Jafia, Latanya, Linda, Shrila, and of course, Judy, for your remarks and keeping our panel going and so engaging. What great conversation. Please stay up to date with our progress. Learn about future funding opportunities as well as other webinars and activities by going to our website, impacthunger.org, and subscribing. We can't thank you enough for everyone who spent the last 75, now almost 80 minutes with us. This is truly just the beginning of our work to end hunger and create healthy, resilient communities for all. Again, have a great day and please stay in touch. Thanks so much.